Now, ahead of International Youth Day tomorrow, we zoom in to the work of Malawi activist Grace Ngulube. She's drawn on her personal experience with HIV to help young women and girls access critical health services despite the disruptions caused by the COVID-19 pandemic. She joins us now via Zoom from Blantyre in Malawi. Thanks so much indeed for joining us and welcome to the program.
Thank you.
All right, so let's start with the work that you're doing to help fight against HIV amongst particularly young people.
Okay, as Grace Ngulube, I work as HIV/AIDS counselor. So I'm a trained HIV and diagnostic assistant. So I counsel people who are newly diagnosed with HIV, and I also counsel young people living with HIV. As a young person living with HIV myself, I make sure that they adhere to their treatment so that they can continue living their healthy life. And I also encourage them on the issues of positive living, because if they accept their HIV status, that's when they are going to be concentrating on their personal opportunities, personal educational backgrounds, whatever they want to achieve in life. So if they accept their status, that's when things can be working better for them. Yeah.
What are some of the big issues that you find that you have to deal with in terms of helping with counseling? I know that Malawi is a fairly conservative country, so stigma is probably standard problem.
Yeah, stigma is still a problem, although it's been done in silence. And you really agree with me that currently even stigma starts in our homes, in our households, and some young people even stigmatize themselves. They are facing self-stigma. They are unable to accept their HIV status. So the issues of counseling, it's not a one-day issue, but it's something that you have to be continuously supporting that person, because it needs to be in them, and they really need to understand the situation that they are being, and they need to understand the reason why they need to be taking their ARVs every day, the reasons why they need to be living a happy and nutritious life. Yeah, so it's really something that it's challenging though, but after some time, people are able to digest and understand their HIV status and live positively. Yeah.
How has COVID-19 disrupted HIV programs in your country?
During this COVID-19 period, and in Malawi, we have noticed a dramatic increase on gender-based violence worldwide, and which has also brought in an impact of increase on teenage pregnancies. HIV infection has also increased amongst young people. I think I read in the news just last week, and I've just found out that during this COVID-19 period, an increase of new HIV infections amongst young people has really increased. And also the teenage pregnancies has also increased since there was a disruption and the lockdown. Young people are no longer going to school, and they had nothing to do whenever they go back to their communities. And you find out that the only thing that they could do is spend their time with their sexual partner, and they have unprotected sex. In that process, they contract HIV, they get unprotected pregnancy, and some adults and girls and young women were being sexually violated by their parents, uncles, and their close relatives, and maybe some people in their communities. So we have really noticed that dramatic increase, and it's not only in Malawi, it's even across African countries.
All right, so
even the access to healthy services has been interrupted. A lot of young people were scared to go to the healthy facilities. Since whenever you go to a healthy facility and you have signs and symptoms of COVID, you are being forced to go for COVID-19 tests. and most of young people interrupted COVID-19 as one of the cause of death. So some people preferred not knowing about their COVID-19 results. And also, if you are going to a healthy facility, you are forced to put on a face mask so that you can protect other people who are at the healthy facility. So most of young people were not affording to buy a face mask. So this really made them not to visit a healthy facility and access other healthy services, and including the ART services that they require as young people.
Yeah, I was just about to ask, actually, access to medication, perhaps another huge challenge.
Yeah.
Yeah. All right. So tell me what some of the challenges have been. I know that with COVID-19, you get young girls now stuck at home for prolonged periods of time. And have you seen a spike in teenage pregnancies that then gets associated with HIV?
Yes, there are quite a number of them currently. There are quite a number. In fact, we don't really have an actual data, but according to some of the findings, we have really noticed an increase in teenage pregnancies, as well as in an increase in HIV new infections amongst the adolescent girls and young women.
So these programs are quite heavily dependent on support from donors. With COVID-19 in play, have you seen these donors turn their attention more to COVID-19 and away from HIV programs?
Yes. I can say that the Global Fund currently has approved a new funding request for Malawi to mitigate the impact of COVID-19, so that it can help the country to adapt to the programs, to adapt to the HIV program, to ensure that there is no interruption of access to healthy services for adolescent girls and young women, even youth in general, and to ensure that young people are still accessing their ART treatment and personal healthy services that they require as young people, like sexual contraceptives, access to PPEs, especially for the healthy care providers and the peer educators who visit these young people in their communities. And we feel like this will also help to spread out the message of the issues of gender-based violence through radio stations and also community broadcasts. So whereby a speaker will be moving around in the community and talking about issues of COVID-19, issues about gender-based violence, issues about access to other healthy services at the healthy facility. So we feel like that's really a big thing for Malawi, and it was a very great action, because it has also helped in the It has also helped for the country to adapt to the COVID-19 environment. And currently, the schools have resumed. Young people are going to school freely, and making sure that there are enough PPEs in schools, so that we can also reduce the number of COVID-19 cases in schools.
I know another issue that you're very concerned about is child marriages, and I guess that makes children even more vulnerable. Not just to the dangers of being pregnant too young, but also HIV is another complication that they become vulnerable to.
Yes. The issues of teenage pregnancies have also increased, especially this time of COVID-19. I can give a scenario whereby a parent was working, and due to COVID-19, they were maybe released from work and they are home. The only option that they have is to send that child to an early marriage, and they receive lobola, and that's like an income for them to start up a business, small business, to support their families. So most of the scenarios where the parents forcing the children to go to an early marriage so that maybe they can earn something out of the sons-in-laws, and you find out that these sons-in-laws are older than these adolescent girls and young women, which is also a very huge challenge. Approximately almost a lot of adolescent girls and young women have been forced to early marriages, maybe because of the teenage pregnancies, and also maybe they have been forced by their parents to marry maybe an older person for them to earn something out of the marriage. Yeah.
Grace Ngulube, it's been a pleasure talking to you. Thank you so much indeed for joining us, and please continue with the great work that you're doing.
Thank you. Maybe just the last word is, yes, I feel like donors and organizations out there need to put in more funding in urgently to meet the new challenges that has been caused by the COVID-19, and making sure that these adolescent girls are still safe from HIV and their planned pregnancies, because we still don't want the new infections to increase. We really want the new infections to decrease. Yeah.
Thank you so much, and I hope that they've listened to your message. But thank you once again. Zikomo Kwambili.
Zikomo.
Thank you.